Hello, I'm going to be demonstrating tracheostomy care and suction. The first thing we want to do is to check the physician's order, make sure that suctioning has been ordered, and also to check the patient's status. Now, the first thing I'm going to do, I'm going to come into the room, I'm going to provide privacy. I'm going to tell the patient what I'm going to do. First of all, I'm going to identify the patient by looking at the armband, make sure that it's the right patient. If the patient can't talk because they have a tracheostomy, I'll just compare the chart records with the patient's armband. And then I'm going to explain the procedure to the patient. After explaining the procedure to the patient, I'll go ahead and do an assessment by listening to the breath sounds, listen to the breath sounds so I can have a baseline of how the patient is doing right now before the suctioning, so I can compare after suctioning. Okay. After doing that assessment, then the next thing I'm going to do is to wash my hands. Okay. Once I wash my hands, then I'm going to hyperoxygenate the patient. Just follow your hospital policy. It's always recommended that patients are hyperoxygenated to get the oxygen saturation between 95 to 100%. Okay. Now we have to be careful when we hyperoxygenate so that we do not hyperoxygenate for more than 2 minutes, so the patient does not have oxygen toxicity. Okay. So now this patient is on oxygen here. I'm just going to turn it all the way up. Okay. And while it's up, I'm going to be opening my sterile pack and everything, so I can use that time, but make sure it's no more than 2 minutes. Okay. Now I've turned that on. Now the next thing I'm going to do is to get my gloves on. So I have my regular gloves on. Okay. I have my regular gloves on. Then I'm going to raise the bed up to a comfortable working condition and height. Okay. So I'm going to check the oxygen saturation either on the monitor or on the finger, just to make sure that that the patient is going to saturate between 95 to 100. I put the side rail down, then I'll go ahead and take off my gloves. I'm going to perform hand hygiene. And then next thing I want to do is to go ahead and put on my mask. It's always recommended that you use the mask that has the face shield. That way if the patient coughs, it doesn't get in your eyes. Okay. Okay, I do have that on. Now I'm going to go ahead and open my supplies. I do have hydrogen peroxide, normal saline, tracheostomy, care set, and 14 French suction catheter kit. Okay. Now I'm going to go ahead and open. Okay. I'm just going to open, keeping in mind the 1-inch border. Just open away from me. That is open. Then open this one again. Okay. Now it's open. The next thing I'm going to do is to pour my normal saline and my hydrogen peroxide. Okay. So now I'm going to open this up, making sure I don't hover over my sterile field. I'm going to pour some normal saline, and then I'm going to pour some hydrogen peroxide. Okay. Okay. Now I have those in there. So I can leave this open. Okay. Now I do have my sterile field here. Okay. Now the next thing I'm going to do is to don sterile gloves. Okay. Get this sterile glove. I'll put my hand in here. Get the next one. Okay. Now I have my sterile gloves on. Okay. Now the next thing I'm going to do is to pick this sheet up so I can drip the patient. Okay. So I've dripped the patient. I'm going to go ahead and my hands are still sterile. Okay. I'm going to open this container that I'm going to pour some normal saline that I'm going to use to do the suctioning. I put it up here. Once I put it up here, now it's time for me to designate my hand. So I'm going to designate this as a non-sterile hand and this hand as the sterile hand. So now what I'm going to do is I'm going to go ahead and pour some normal saline into there. Okay. I grab this. This is no longer sterile. I'll pour it in there. And then I'll go ahead and turn this down. Now I'm getting ready to remove my patient's oxygen connection. But before I do that, this hand is still sterile. So I'm just gonna soak some 4x4s in the normal saline, which is this one, okay? I'm gonna soak some 4x4s, put them in there, okay? Now it's in there, okay? Now I'm gonna go ahead and use my non-dominant hand, which is no longer sterile, to remove the oxygen connection. Okay, and I'm just gonna keep it right here. That way it's close by in case I need it. Okay, now it's right there. Okay, just keep it there. This hand is still sterile, okay? Alright, now the next thing I'm going to do is I'm going to pick up my suction catheter. Once I pick it up, then I'm going to go ahead and hold here. This hand is still sterile. I'm gonna get it out of the container carefully. Okay, carefully. Okay, now I'm gonna put this away. Okay, now I'm going to connect this to the suction okay, and then I'm going to turn the suction on to 80 to 120. I'm going to use 100, okay? So I'm going to turn this on, then I'm going to turn it on to 100. It's at the yellow, okay? Once I turn it on, I'll go ahead and grab this. Once I grab this, I'm going to test it, make sure that it's suction. I can feel it is suction. Then I'm going to go ahead and connect. Once I connect it, it's connected, okay? Now my hand is sterile, okay? Now what I'm gonna do is I'm gonna go ahead and lubricate this catheter and also make sure that it's working. Okay, I've lubricated. I'm gonna check if it's working. Now remember that I've just touched the green button with my non-sterile hand, so this green button is no longer sterile, okay? All right, then I'm gonna go ahead and suction the patient, okay? Now I'm gonna go in 4 to 5 cm in, okay, until I meet resistance. That way I know I'm at the carina. Okay, once I go in, I'm not suctioning. Now I'm going to tell the patient to take a deep breath, okay, and then okay, hold your breath. Okay, I'm going to just the circular motion come out. Okay, so once that is done, I'll go ahead and rinse it, you know, kind of make sure that the line is clear. Okay, all right, I'm gonna go ahead and go in again. Okay, tell the patient to hold your breath. Okay, all right, go ahead, hold your breath. I'm gonna go in 4 to 5 cm, and then I'm gonna come back again in a circular motion. Okay, okay, once that is done, make sure that the suctioning process does not take more than 10 seconds, okay, so the patient doesn't lose a lot of oxygen. Okay, once that is done, I'm ready to disconnect my catheter. Okay, make sure I don't touch the green, because the green is no longer sterile. I touched it with my left hand, so I'm just gonna hold here and I'm just gonna disconnect that. Okay, and I'm just going to put this suction back here, and then I'm just going to I can use my 1-inch border here, bring this up all the way down here, and I can drop this here just in case I need it again, but I don't think I will need it again. All right, okay, just lay that there. Okay, now next thing I'm going to do is to use my non-dominant hand, my non-sterile hand, to take out the inner cannula. So I'm going to take out the inner cannula. Okay, so I take it out. Okay, now this is my hydrogen peroxide, so I'm going to put it here in my hydrogen peroxide. Okay, so I put in my hydrogen peroxide, kind of, okay, I don't know how to put it. Okay. Okay, put it in there. Then the next thing I'm going to do is to use my non-dominant hand to take away the dressing that is on there. Okay. All right. So I'm going to go ahead and remove the dressing. Okay. So I remove the dressing. I put it in a receptacle. And the next thing I'm going to do is go ahead and clean my inner cannula. Okay. With my non-dominant hand, I'm going to hold the tip. Okay. This hand is still sterile. Okay. I'm going to get this. What do you call it? The brush, my little brush here. I'm going to put it in there, and then I'm going to go in to kind of, you know, clean it, and then I'm going to go again. I'm going to clean. Then be sure to clean the outside also. I'm going to clean the outside with the hydrogen peroxide. Clean the outside. Brush the outside. Really good. Okay. Alright, so once that is done, I don't need this brush anymore. So I can just put the brush here. This hand is still sterile. I haven't touched anything yet. Okay. So I'll rinse. Okay, you can try to scoop some water out of here and let it drip back this way. Then the next thing I'm going to do is I'm going to take out the soaked gauze here with my sterile hand. Put them here. Then I'm going to use the normal saline to rinse the inner cannula. Okay. Rinse. You can take some water in there and let it drip. Take some water in there and let it drip. When it's rinsed properly, then next thing I'm going to do is to dry it. I do have some of these things here that we can use to dry it. I'll just put my hand, these little sticks here will dry it. Okay. Alright. Don't need that anymore. Pick another one. Remember, I rinsed the normal saline after the hydrogen peroxide, and now I'm drying. Okay. Dry. In and out. Dry. Okay. Alright, I've used the third one. There's a fourth one here. Everything here is still sterile. My right hand is still sterile. So I've dried. So after the drying, then I'm going to go ahead and put on my put my cannula inside. Okay. Now it's always good to go this way. Point towards you and then rotate down. It's much easier to put that way. See? Easy. And then it snaps in. Okay. So once that is snapped in, I've pretty much taken care of my sterile part of the whole procedure. Okay. Now the next thing I'm going to do is to clean the under the patient. Okay. So I'm going to clean. Just gonna clean with one wipe. Clean. I'm gonna throw that away. I'm gonna take the second one. Let's raise this up. I'm gonna clean under there. Okay. Once I've cleaned, depending on how many soaked gauze you have, 3, 4, you know, once that is clean, next thing I'm going to do is to go ahead and put the dressing under the skin. So your pack usually comes with this pre-cut gauze. So I'm just gonna go under. And just making sure that I stabilize the cannula so it doesn't come out. Patient doesn't get decannulated. Okay. Stabilizing that. Go this way. And make sure you get it all the way out so it's not kind of all muddled up there. Okay, there you go. Okay, now we will go ahead and change the strap that is soiled. So for the strap, we will just be we'll make sure that we get the second one in before removing the first one so that the patient doesn't decannulate. Okay, so I'm just gonna go ahead and right. Okay, so I'm going to be starting from this side. Okay, I'm just gonna go under here, get it in, put this in here. Okay, that is in. Okay, remember I still have the old one, but I'm gonna take it off once this one is in place. Okay. All right. I'll get the patient off here. Okay. All right. I'm gonna use the short end to put in here. Thread it across, and then I can use this to tie my knot. Kind of make a belt. That way it's easy to remove if we need to. Okay. Then I'm gonna go ahead and remove the old one. I'll just pull the belt from the old one here. Moving one at a time. Okay. Then I'm gonna go behind the back and just try to remove. I can find it. Just make sure that the trach is still stabilized while you're trying to do this. Kind of keep an eye on that. Okay. All right. And then I just pull the old one. Now I have my old one is out. Okay, and then you put the patient back on the oxygen. Okay. Okay, now make sure that this blue thing you don't touch it, because just leave it alone the way it is. Okay. And then you go ahead and remove all your supplies and discard, and then remove your sterile gloves and your mask, and then you wash your hand. You document what how the patient tolerated it. Get the side rail on. Get the patient to a comfortable position, and you document how the patient tolerated it. You listen to the breath sounds and see if there's any improvement from the procedure that you just did. Thank you for watching.